Milaria, continuing with it, we are looking at the clinical features. In clinical features, first one is the Milaria crystallina. So the Milaria crystallina is nothing but it's clear. It is thin walled vesicles, and looking at the diameter, it is 1 to 2 mm in diameter, and it is without an inflammatory areola. Without an inflammatory areola, and they are symptomless, and they develop in crops, and it mainly is on the trunk, and it is persistent febrile illness. It's a febrile illness, and there are recurrent crops may occur, and the vesicle soon ruptures and are followed by superficial as well as brani desquamation. Next we are looking at the Milaria rubra. So in case of the Milaria rubra, it is a typical lesion. It develops in the body, and especially in areas of friction, that is with the clothing. It is nothing but the flexus. The lesions uniformly and minute erythematous papules. So there is a minute erythematous papules, so which may be present in very large numbers. So it is present in very large numbers, and characteristically the lesions, it produces intense discomfort. So it produces intense discomfort, and this is in the form of unbearable pricking sensation. Unbearable, there is pricking sensation. The relief is often it is instantaneous, and when the stimulus to sweating is abolished. So sweating with showering, so treating sweating with showering, it reduces the outcome. And next, in case of infants, the lesions commonly appear in occluded skins of the neck. So a similar thing in infants, you can have it in the neck, the groin, as well as the axillae, and it can occur elsewhere as well. Next, looking at the Milaria profunda. So the Milaria profunda, it nearly is always, it follows the repeated attacks, and this is of the Milaria rubra. Next, it is commonly only in tropics. The lesions are easily missed, and the affected skin is covered with pale firm papules, and these papules are about 1 to 3 mm across, and especially on the body, but sometimes it also on the limbs, and there is no itch or discomfort from these lesions. Now is the concluding part with the treatment. How to treat this? So here you have the first line. First line includes the control the local environment, and this is nothing but to remove the excess bedding as well as fans and air condition. Next would be to cool the skin, and this is by applying damp compress as well as the cool showers. Next would be to avoid the tight as well as the excess clothing. So now we're coming to the second line of treatment. It is by administration of menthol. Menthol is nothing but 0.5 menthol in the aqueous cream. Next, what is seen is the topical antibiotics, and if there is a secondary infection, so in case of secondary infection, then would be to administer the mild topical steroids. Now looking at the third generation, third line of treatment, it is by the removal to the cooler climate, as well as it can be the prophylactic oral vitamin C.